Hey guys. Welcome back to another episode of Health Tea with Dr. B, the MP. Episode 19. So I was corrected last week. So apparently, I definitely had the wrong idea. I thought 2 weeks ago we were on episode 19, but comes to find out, we were on episode 18. So I jumped the gun a bit. So we are on episode 19 of Health Tea with Dr. B. Thank you all so much for joining. How has everyone been? It's been hot. I was in Utah just a few days ago and heard that we were in another heat wave. It went up to like 105 degrees. And this heat is different. It's like when you walk outside, you're literally walking into like an oven. I don't know what to say about it. So please stay hydrated, get your electrolytes up, use sunscreen, take your vitamins, and try to stay cool. But most importantly, continue advocating for yourselves because your health is depending on you. So, before we begin tonight's episode, here is a friendly reminder. If you are in Maryland, Washington, D.C., Colorado, New Mexico, Washington State, and Utah, and you are seeking treatment, the link is in my bio. That is bit.ly/health tea with Dr. B. If you are ready to reach optimal health, I am right here waiting for you, and I am always rooting for you. I specialize in PCOS, perimenopause, menopause, functional medicine, weight loss, and thyroid optimization. Also, if you would like to be a guest on the show to share your experiences or ask questions, please send me a message directly on Instagram or Facebook, or send me a message at bit.ly/health tea with Dr. B. So, today we are diving into a topic that's been making waves on social media: good old progesterone. So, get ready for this tea that I'm about to spill tonight. But first, let's get into this hot tea tonight. Literally. All right, so what are we going to be discussing today? Blue vervain tea. Not sure if you all will be able to see this. Ooh, there we go. Blue vervain tea. I believe I'm saying that correctly. Well, you all know that I always introduce a new tea every time we do this episode because it's supposed to connect to our topic and promote health. Okay, so what is blue vervain? Blue vervain tea is Verbena hastata. So blue vervain is a perennial herb native to North America and is known for its tall spikes of blue violet flowers. I have not seen this tea in person, but it's often used in traditional medicine for its potential health benefits. So, how did I make my tea tonight? Well, I steeped it. I steeped the dried leaves and flowers of the plant and put it in hot water. So, this is what it looks like. It is pretty hot. So, let's talk about the benefits first before I taste it. Because you all know 2 weeks ago I had the dandelion tea and that was a no no. However, it was very beneficial. So, what are the benefits of blue vervain tea? Relaxation and stress relief, we all need that. So it's known for its calming properties. Digestive health, which I need desperately. So it is known to promote healthy digestion and it can help relieve issues like bloating, gas, and indigestion. And it's also used for a natural remedy for stomach cramps and mild gastrointestinal discomfort. It also has compounds of anti inflammatory properties. This should be a word that we're always hearing about: anti-inflammatory, inflammatory. We are always hearing about something. It's always something when it comes to inflammatories, right? So it has an anti-inflammatory relief system. It also helps to improve our immune system. So it helps to fend off colds and other minor illnesses. It's good for our respiratory health. Please, guys, please build up your respiratory health. Why? Because there's a lot going on. Right now, we're seeing spikes of COVID, flu, strep, and sinus issues, and blue vervain can help with cough and congestion. It also helps with detoxification, mood enhancement. Okay, so it can help reduce symptoms of depression, but most importantly, it is known for hormonal balance. So, particularly in regulating menstrual cycles and alleviating symptoms of PMS and menopause. Okay. All right. So, tonight's disclaimer: The content provided in today's session is intended solely for informational purposes and should not be construed as direct medical advice. While I aim to share valuable insights and knowledge, it is important to remember that I am not your primary care doctor. The information shared does not replace your doctor's medical advice, diagnosis, or treatment. So if you have specific health related questions or are seeking treatment based on the topics discussed, you are encouraged to contact me directly at bit.ly/health with Dr. B or consult with your doctor for personalized medical advice. Your health and well being are paramount, and getting advice tailored to your individual needs from a licensed healthcare provider is essential. So, before I forget, let's taste the blue vervain tea. So, not bad, not bad, not bad at all. I didn't know what to expect. After 2 weeks ago, we had the dandelion tea. I didn't know what to expect this time, so I think I have a little PTSD from it. But honestly, it's not bad at all. So I can't complain at all. I would like to note that I am streaming live on 3 platforms. We have Instagram, Facebook, and YouTube. So you all can follow me everywhere. All right. So now let's sip, listen, and thrive. So again, welcome to Health Tea with Dr. BDMP. Today we are diving into the importance and benefits of progesterone, often referred to as the secret sauce for women's health. So let me start off with a personal professional story. Okay. So sit tight. I had a patient come to me for functional weight loss because she heard that I get to the root cause of weight gain and not just cover the potholes. I love that for her. I love that for me. But during her assessment, we did discover that she had severe vitamin deficiencies, which does impact your weight loss, right? But not only that, she had subclinical hypothyroidism and she was in menopause. So she started on the weight loss injections and she was doing okay, but she felt terrible. She came in angry every visit and was always stressed. It was to the point where I almost didn't enjoy her coming to the office. I was like, oh my goodness, if she comes again, she is going to be angry. She's going to be just, always just a Debbie Downer, right? So I just took the leap and said, let's talk about hormones. We discussed hormones. I educated her on hormones and she was sold. I was sold because she was sold because we really need this. Okay. So we started her on testosterone. And yes, women need testosterone too. We also started her on estradiol, non-desiccated thyroid, and progesterone. And I kid you not, for the next 2 weeks, she was the most pleasant being. She reported better sleep. She didn't want to strangle her husband. And she just felt amazing. The power of hormones, the power of progesterone. And that is what we'll be discussing today. So, what is progesterone? Progesterone is a hormone produced primarily in the ovaries and the adrenal glands. Okay. But now we're about to get real technical with it just for a moment. Okay. So, tune in. After ovulation, basically during the luteal phase of the menstrual cycle, the corpus luteum, which develops from the ruptured ovarian follicle, secretes progesterone. And it primes the uterine lining for potential implantation in pregnancy. All right. This is why progesterone is known as the pregnancy hormone. So, if no pregnancy occurs, the progesterone levels are going to decrease and it facilitates the shedding of the endometrial lining. And that is, well, if pregnancy does occur, progesterone will continue to be secreted by the corpus luteum in early pregnancy, followed by the placenta later on in pregnancy. Okay. Progesterone also has a relaxing effect on the smooth muscle of the uterus to prevent uterine contractions that could expel the fetus prematurely and regulates the maternal immune system. Oh, sorry about that. So here is what I said. It has a oh, sorry guys, 1 second. All right, guys, I am back. I don't know. I think something just tried to take me out. They heard me talking about progesterone and its benefits. And next thing I know, I just started choking. That is what happened. But let's get more into the progesterone and its role. So basically, I did mention that progesterone has a relaxing effect on the smooth muscle of the uterus to prevent uterine contractions that could expel the fetus prematurely. So, please have that stick with you because we are going to talk about the benefits of progesterone and why it is super important, especially during pregnancy. Okay, so let's talk about the roles of progesterone. What is the role of progesterone in menstruation? Well, progesterone is secreted by the ovaries to prepare the inner lining of the uterus, which is the endometrium for pregnancy. And it also inhibits muscular contractions that prevent the egg's adherence to the uterine wall. So, again, if the egg is not fertilized, then the ovaries will cease secreting progesterone. And again, after a few days, the drop in progesterone levels causes the endometrial lining to break down, and that is when menstruation begins. Now, what about pregnancy? What is its role in pregnancy? So, following the implantation of a fertilized egg, the placenta, that's an organ produced by the developing embryo, supports additional progesterone production. So during pregnancy, progesterone influences the production of inflammatory mediators such as white blood cells to ward off any infectious threats to the developing embryo and fetus. So, after the baby is born, progesterone supports milk production for nourishment. Okay? But here is something else that is not commonly talked about, and that is progesterone's role in males. Yes, males. In males, progesterone facilitates sperm development and testosterone synthesis. It facilitates the process of capacitation, and that is the interaction of the sperm with the egg. So, progesterone also decreases the risk of developing an enlarged prostate, also known as benign prostate hyperplasia. Okay, so you're learning a lot here about progesterone, and this is just the more technical things about it, the things that you might not be able to absorb because it's so technical, but just know that it is there and you can always rewind these videos. Okay, and so what is the role of progesterone in reproduction? So progesterone always plays a role in reproduction in other ways. It causes an increase in the mucus lining of the cervix and it thickens it. So this provides a barrier for sperm to penetrate through, preventing additional fertilizations. Okay. And again, it also plays a role in immunity. Oh my goodness, sorry guys. Protecting the cervix from infections. I think the tea is trying to take me out, y'all. This is the blue vervain. I think it's trying to take me out for some reason. I don't know what's going on. But now let's talk about progesterone's role systemically. Okay. So it has been studied and proven in some cases that progesterone may also have a role in osteoporosis and in preventing nervous system disorders in both sexes. All right. It has been touted to protect the woman from breast cancer and other female problems resulting from unopposed estrogen. And we're going to talk about that shortly. Okay. And so, what do I mean by systemic functions of progesterone? So, what does it actually do for us? What does it do for women? Okay. It helps to relax smooth muscle cells. So whenever you hear anyone saying, "Hey, what does progesterone do for me?" I always tell people that progesterone is nature's Xanax because it has anti-anxiety and antidepressive effects. Okay? So when you are taking progesterone, some people notice a decline in their anxiety. All right? It helps to improve visual memory. It helps to improve your pain. So it has sedative and analgesic effects. So it helps to reduce the pain. It helps to raise your basal body temperature. It helps to relax smooth cells. Okay? And so, truly, what is the impact of hormones? Hormones act as the body's chemical messengers, influencing almost every organ and function. And progesterone, again, is well known for its role in pregnancy. However, it influences many aspects of our health, including mood and well being. So, I want you to understand estrogen and progesterone. Testosterone is still there, but estrogen and progesterone are going to be our main topics for right now. So, when you think about the female's reproductive system, I want you all to think about the female's reproductive system as being the lawn or a garden. Okay. Estrogen is going to be the grass. Okay. It's going to be the grass of our reproductive system. And the progesterone is going to be the lawnmower. So, whenever you have grass that's growing tall, that is your estrogen, you're going to have heavy bleeding. And I mean menstrual bleeding, probably heavy cramps. You're going to be very moody. So, either depressed, anxious, irritable, angry. You might have weight gain. You might have bloating. You might have swelling. You might have nipple tenderness. All signs that you can think of with PMS. So remember, the higher the grass or the taller the grass is, the heavier your symptoms are going to be. And now, when we're thinking about progesterone, our lawnmower, if we don't have any progesterone, if we have a progesterone deficiency, guess what? You're going to have these severe PMS symptoms. No way, no doubt about it. You're going to have them. You need that progesterone as the balancer. The progesterone balances out the estrogen. So when you have enough progesterone in your system, guess what it's going to do? It's going to cut down that grass, meaning that your cycles are going to become lighter, right? The bleeding is going to be lighter. The pain and the cramping should be better. You are no longer moody. You have more free space in your brain because it's no longer cluttered with anxiety, depression, and all kinds of mood issues. Okay? So, what did you get from this? Estrogen is the grass, progesterone is the lawnmower, and the progesterone is basically what balances out the estrogen. And what does that mean to you? That should mean to you, especially those who are suffering with heavy periods, hey, you may have a progesterone deficiency. There may be a reason for your bleeding. You might need progesterone. So, what are the symptoms of low progesterone? Because low progesterone levels can cause a variety of symptoms, many of which are linked to fertility and reproduction. Okay, so let's talk about it. We have abnormal uterine bleeding, anovulation, which are missed periods or irregular periods, spotting or abdominal pain during pregnancy, frequent miscarriages. Hint, hint, this is why progesterone is needed for pregnancy. If it's low, you might not have a successful pregnancy. Early labor, PCOS, also known as polycystic ovarian syndrome. High estrogen symptoms, so decreased sex drive, weight changes, and gallbladder issues, and mood fluctuations and worsening of PMS, also known as premenstrual syndrome or PMDD. And that is premenstrual dysphoric disorder symptoms. So you might be more irritable and have aggressiveness and high fatigue, especially in women. Now, we always hear about low progesterone. What about symptoms of high progesterone? So we have drowsiness, breast tenderness, bloating, mood changes, lower sexual interest, and emotional eating and cravings. Okay? So that is why when sometimes women are placed on progesterone, they talk about breast tenderness. Okay? So see, everything is starting to link up. It's starting to connect. So how do you test for progesterone levels? Well, testing is essential for accurate diagnosis and treatment, but typically we do blood test or a Dutch test that involves urine or salivary test, which is saliva. Okay? So let's really get into the benefits of progesterone. We spoke about some earlier about progesterone being nature's annex, but there's so much more to progesterone. Progesterone provides several health benefits beyond its role in pregnancy. And we have cancer prevention. So, contrary to misconceptions, progesterone does not promote cancer, it actually safeguards against it. So, if progesterone caused cancer, pregnant women would be at high risk, but they are not. Okay? In fact, women with multiple pregnancies who have higher progesterone exposure often live longer. So let me say that again for those in the back who could not hear me. Contrary to misconceptions, progesterone does not promote cancer, it safeguards against it. So if progesterone caused cancer, pregnant women would be at risk, but they are not. Okay? And then cardiovascular health. What do you all know about progesterone and cardiovascular? Did you know that progesterone plays a crucial role in protecting premenopausal women from cardiovascular diseases? It promotes blood vessel relaxation. It reduces the blood viscosity, so it thins it out. And it ensures proper calcium regulation. So it helps keep the heart healthy and efficient. Okay. This helps to decrease the risk of cardiovascular disease. Studies show that premenopausal women are at a lower risk of developing cardiovascular diseases than men, and it is because of progesterone. So that leads us into the tea about the myths on progesterone, because I hear so many things about progesterone and so many things that grind my gears. Why? Because there is science out there that proves certain things. So, debunking myths about progesterone. I always hear about people saying progesterone causes cancer. In fact, it does not. But you know what does? Synthetic progestins, which are not bioidentical progesterone. That is what was found to increase breast cancer risk. Not natural progesterone, synthetic progestins. This is where the talk about progestins come in. Progestins and progesterone, those are not the same. So whenever I get a patient who says, hey, I want to start in your program. However, I only want for you to give me a progestin because they're the same thing. False. Progestin, progesterone is chemically identical to the hormone made by our bodies, made by yams, right? While progestins are synthetic and may have side effects such as acne, breast pain, nausea, weight gain, headaches, and irregular periods. So that's why when I see people who are on progestin, they all have the same complaint. Man, I had to go to the emergency room because I bled heavy. I bled heavily during my menstrual cycle, right? That is progestins, okay? And what about that other myth that we always hear? Progesterone is not needed after a hysterectomy. False. Progesterone has benefits that go beyond uterine protection, such as helping with anxiety, mood swings. bone health, so osteoporosis, nerve health, and weight management. Like, we really have to be educated and know what is a myth and know what is the truth. Even oral and topical doses of progesterone, they say, oh, that's interchangeable. Um, if you do 100 milligrams orally, then you should do 100 milligrams for the topical cream. False. Oral progesterone is most commonly used for insomnia due to its metabolite, allopregnanolone, which makes you sleepy. However, 80 to 90% of the oral dose is removed by the liver. So, a 100 milligram dose is roughly equal to about 10 to 20 milligrams of a topical cream. So, make sure you go to a provider who knows these things, okay? Because that's one of the things that I always hear. And then lastly, progesterone helps slash worsens anxiety. Well, both can be true depending on the balance of other hormones. So for women with normal cortisol, progesterone can be calming, right? However, if your cortisol is low, your progesterone might be used to produce more cortisol, which causes increased anxiety. So there's that. So, guys, I'm just going to be so real with you all. I think I'm having an allergy to the tea. Look at that. See, this is the real tea. This is the this is the real tea, guys. I think I'm having a whole allergy when it comes to this tea. Now, listen, right? I want to tap myself. I want to still drink it just to figure out what's going on because I'm one of those providers. But I'm having all kinds of symptoms over here. So this is why I always give the disclaimer. These teas, or they're not meant for you to just treat yourself. Sometimes you might have a reaction to it, but I think that I'm having a reaction to it. My nose is running, my eyes are watering, my chest is so blue vervain. I'm not sure if you're it today. All right, but let's get back to progesterone. All right, because I'm about to give you the real tea, pun intended. Many faces of progesterone. So here are some good facts here. Progesterone is being studied for its potential in treating various conditions beyond its traditional uses, right? So we've talked about progesterone and how it is during pregnancy and things of that nature. But listen to this. Progesterone is being trialed for multiple sclerosis treatments. So, MS. MS is more common in women, especially during reproductive years. So, they are suggesting that it is a hormonal imbalance or connection, right? So, progesterone is being studied for its MS treatment because it plays a role in repairing the myelin sheath that deteriorates in MS. That is awesome. So, you mean to tell me progesterone is about to start treating MS patients? Amazing. And then Alzheimer's disease. If anyone knows me, Alzheimer's dementia patients always have my heart. Those are my babies, my favorite population. But progesterone is gaining attention for its treatment due to its brain protective properties. What the heck? So now guess what? It makes you think, right? It makes you think, does this person have dementia or Alzheimer's because of a lack of hormones? It's just something to think about. I'm just going to put it out there, right? And then another phase is miscarriage and infertility. So progesterone has been studied for pregnant women who have previously suffered miscarriages, helping to increase the chances of a successful pregnancy. Thus far, I've had about 10 successful pregnancies with the use of progesterone when they first conceived. Okay. And then osteoporosis. Progesterone is now being used for treatment for osteoporosis. So that is why whenever I have a patient who comes in for hormone replacement therapy, I actually check their urine to see what stage they are in, or not necessarily what stage, but to see if they're at risk for bone loss. When I see that they are, that is when we start our hormone therapy. And a few months later, we check it again to see that the bone loss is being reversed. It's completely amazing. And then Progesterone has also shown promise as a treatment for blood clotting disorders due to its anticoagulant properties. Another amazing thing. So it makes me think, man, do those with low progesterone, do they have thicker blood? It's just a lot to think about. And lastly, like the last amazing fact for today, progesterone is also being studied for epilepsy treatment because of its calming effect on brain cells. Like, it's a whole brand new world out here when it comes to progesterone. Like, I take progesterone. Why do I take progesterone? I take progesterone because I recently found out, maybe a year ago, that I am a PCOSer, right? Miscarriages, heavy periods. I mean, since since I first started a period, I always wanted to be a guy because they were that bad. And then to just find out so many years later that, hey, that was PCOS. Hey, your symptoms are PCOS. Your PMS, PCOS. So guess what? I got started on progesterone, and I've never had an issue with sleep, but I had always had an issue with anxiety and PMS and all that. And I kid you not, my symptoms have been completely regulated. Okay. And now I take progesterone. I cycle mine though, day 14, 24, or day 14 and 29. But I also did natural ways to increase my progesterone because there are different ways. So when it comes to conditions where progesterone is prevalent, we are going to need a low inflammatory diet, also known as the Mediterranean diet. Okay. So I did something called clean keto, and I did it for about 12 weeks, and I lost so much weight and I felt so much better. Okay. Reversed my insulin resistance. Okay. And it positively affected my stress hormone cortisol. Okay. So when it comes to naturally raising your progesterone, you really do need to fix your diet, but you also need to include essential nutrients, foods that are rich in zinc, vitamin B6, and magnesium. These are all important as they do play a role in progesterone levels. So, zinc rich foods include oysters, beef, blue crab, oats, pumpkin seeds, lentils. Okay. So, this trace mineral is essential for many physiological functions, including hormone receptor functionality. So, if you get enough zinc through your diet, it can help support progesterone production. And just know that your progesterone is also produced in the adrenals. Small amount, but there's enough that's produced there too. And then we have vitamin B6. Please increase your vitamin B6 because hormone metabolism from the liver and the anterior pituitary gland, it is affected by B6. So here are some foods that have high B6. Chickpeas, beef liver. I know some of you guys are not liver fans, but I am. Beef liver. Fish, so that includes salmon, tuna, yellowfin. Chicken, potatoes, bananas. And then we have magnesium. So, a deficiency in magnesium can result in reproductive health issues such as painful periods, PMS, and postmenopausal symptoms. So, remember that these symptoms are also present with progesterone deficiency. So, you see how that kind of came back full circle? So, here are the top magnesium containing foods: almonds, flax seeds, black beans, quinoa, yogurt, spinach, avocados, dark yogurt, or excuse me, dark chocolate. Um, it's all about your diet. You don't necessarily need a supplement. Sometimes you can get it from the earth here. However, there are still herbal supports for increasing progesterone, okay? Because sometimes we need that extra help, like chaste tree. So we have the Vitex agnus castus, and that plant medicine is pretty much known for its progesterone promoting capabilities. So whenever I do get a PCOS patient, I say, hey, get some chasteberry. Okay. Typically, after 3 months of treatment on the 20 milligrams of the Vitex or chasteberry, um, Some of the women had decreases in prolactin. Their luteal phases were normalized and their progesterone levels had increased. So that means that their PMS decreased. Okay. So Vitex, that dose can vary, but starting with 20 milligrams is an average starting dose. But again, please consult your doctor who is helping you with this. Okay. And then we have this lovely maca root. Okay. So there was a study of perimenopausal women who took 2 grams a day of the maca. And it actually revealed that there was an increase in progesterone and other sex hormones. So be careful with maca, though. Be careful with maca. They always say take maca if you want your breasts to grow, if you want to get thicker hips, or increase your libido. Just make sure that you're being monitored. I know so many people who take so many different hormones, or excuse me, so many different supplements, and they never know what is going on with them and what's happening. So you just want to make sure that you're doing everything safely. Okay. And then stress management. That that's probably the hardest thing. That comes probably before your nutrition, managing your stress. And there are numerous reasons as to why women experience stress. One of them being progesterone deficiency, and it is linked to mood imbalances. So, low progesterone can lead to mood and mental health issues such as anxiety, depression, and anger. And this is going to trigger a stress response, which propagates a vicious cycle due to the stress hormone cortisol negatively impacting your sex hormones. So, how do you decrease stress? Hey, we always say therapy. Sometimes we say ashwagandha. We need certain things to help us calm down. But if you're not really into the supplements, we have meditation, we have yoga, we have exercise, and sleep, because sleep is essential to healing. So when you create a healthy sleep hygiene routine, getting enough hours of sleep and restorative quality of sleep will help regulate your circadian rhythm. This is an essential part in supporting appropriate stress hormone responses. So, again, it is extremely important for us to normalize or try to decrease our stress. We always talk about stress, and sometimes stress, we always say it can be overrated, but truly it is underrated, because we think that it's overrated, that we underrate it. And really, we really need help with stress management because it truly does affect our hormones. But we do live in society in 2024, so I do understand that monitoring or decreasing your stress may not be the easiest thing. Okay. So for those who need more support in balancing their progesterone levels, there is bioidentical hormone replacement therapy. So here at True Phoenix, that is my clinic, I offer BHRT, which means that we use natural hormones. We don't use progestins. We don't use any synthetic hormone at all. And those who are asking about Prometrium, that is not even, we can't even use it in the US anymore, or we can't get it here. You can get it in Canada, but you can't get it in the US. Okay. But BHRT can be a very effective solution. However, you must always go to a provider who is either a specialist in hormones or WorldLink medical trained. I am a WorldLink medical trained provider in hormones, and I pride myself on being WorldLink medical trained. Why? Because we get so much information. The training is evidence based. I've read about maybe 700 articles. My brain will probably explode. But there is always so much. And Dr. Neil Rousier is amazing at what he does. Okay? So remember that BHRT can help address hormone imbalances and alleviate symptoms associated with low progesterone. And remember, mood swings, sleep disturbances, reproductive issues. These are all symptoms of low P4, also known as progesterone. So always consult with your healthcare doctor to determine if BHRT is right for you. Don't just start it. Don't take anyone else's. You need your own levels. Okay. So to recap, progesterone plays a crucial role in our overall health and well-being, far beyond its role in pregnancy. It is known as the pregnancy hormone, but it's so much bigger than this. And understanding its impact on various aspects of health is essential. for addressing hormone imbalances effectively. So, progesterone is more than just a hormone, it is a crucial player in maintaining our overall health and wellness. I'm sure you all are tired of experiencing severe PMS, anxiety, irritability, anger, poor sleep. I know I'll be tired of that. Okay. You need to have your progesterone checked. And it sucks because progesterone is often overshadowed by its better known counterparts, such as estrogen. Estrogen gets all the love, but progesterone deserves recognition as one of the most protective hormones in the human body. Okay. So please don't forget that. Thank you all for tuning in. I've had a few new followers, especially now that I'm on Instagram. I know how to do it now, so I'm excited. Thank you all for tuning in to Health Tea with Dr. Beauty MP. I definitely encourage you to ask questions and share your experiences because each person has an experience when it comes to taking hormones. I just don't want you all to be um, discouraged by it if your journey was a bit different. Okay. But thank you all for joining and supporting Health Tea with Dr. B. Officially in 2 weeks, we'll be on episode 20. Okay. 2 weeks, episode 20. I'm super excited. Please follow Health Tea with Dr. B on Facebook, Instagram, and YouTube. We're going to have some new things in the next upcoming weeks, new guests. It's time for us to jazz it up just a bit. I'm glad that you all have been with me. You guys been rocking with me for a year, especially after I took the hiatus. And for all of you who do not know, I did take a hiatus. Um, just because there was a lot going on. We had an influx of patients, and one of my first patients who started with True Phoenix actually passed away in January. I wouldn't say that I didn't take the death very well, but she was very special to me, very special. So I wanted to make sure that I came back nice and strong for all of you. But again, if you guys have anything that you ever wanted to talk about, let me know. Um, I come out with these episodes. Sometimes they're not pre-planned at all, like this one. This one was not pre-planned. I kept hearing about progesterone, progesterone, progesterone. I just decided to do a nice little podcast about it. But please ask questions. I'll be glad to answer them in a live or at another Health Tea with Dr. B. So thank you all for joining. Please visit bit.ly/Health Tea with Dr. B. If you have any questions, if you want to be a guest on the show, or if you want to see where I get my mugs from. Now, today, I want to promote Blue Vervain, but honey, it almost took me out. It almost took me smooth out. I'm just getting over it. But you all, thank you for joining. I really do appreciate every one of you. Thank you so much and have a great night. Please stay cool, stay safe, and I'll see you all in 2 weeks. All right, guys. Bye.